Hello and welcome. This is Dr. John Dombrowski from Washington Pain Center, going to talk to you about spinal stimulation. I just recently did a YouTube search on spinal stimulation, and I can't believe how much information is out there, and that's great. And again, I'm not a salesman. I don't pretend to be one. There's a lot of information out there that I think is very good, but also I think that some is a little controversial. I'd like to spend a little time to kind of talk to you about why spinal cord stimulation should be considered. Again, spinal cord stimulation is simply a pacemaker for pain. Nothing more, nothing less. It really has been around since the 1970s. This is not new technology. Now, it's gotten better over the past probably 10 years, but basically it is still the same. You have a computer, you have a battery, which is the same, and then you have this little lead or piece of spaghetti essentially that connects the electricity near the spinal cord. Again, with this type of technology, this can be very successful for patients with previous back pain that have failed surgery, medication management, other interventions. If you have back pain going down your leg, extremely helpful. If you just have back pain, it can be very helpful. And it's also helpful for patients with neck pain and arm pain, and obviously this would be placed in the neck region. How do you do this? Again, the reason I think this can be so successful and such a game changer is that the patients are completely awake when you do the procedure. There's a trial period. I really don't know any other surgical event in the United States where you can try it out. If you get a fusion, if you get a laminectomy, or any other thing, you have to buy the whole enchilada. You have to get the whole thing done, 6 months of recovery, and at the end of the day, geez, doc, I really know better. Actually, I'm a little bit worse. And that's tragic. And then at the end of the day, the patient might say, hey, put me back to where I was. Well, they really can't do that. They change you anatomically. That's what surgeons do, and they do a great job at it. Now, what an anesthesiologist and pain physician does is basically change the way you feel about your pain and not your anatomy. You don't change anatomy, we change the way you feel about your pain. So again, if you're a patient considering spinal cord stimulation, consider this. Go to an individual that does this all the time. Make sure this individual is board certified as an anesthesiologist or physical medicine rehabilitation doctor. You also want to make sure that they're probably in a society that does a lot of neuromodulation, so they're comfortable with the technology. Again, how is it done? Basically, what's going to happen is the patient will come to a fluoroscopy suite, or they will come to a surgery center, whatever the physician wants that patient to do. Normally, the patient will receive antibiotics, but probably some medication to kind of take the edge off, some sort of anxiolytic, take the edge off medication. Now, depending on the patient's age, I might not give them that type of medication because I really need to have good verbal communication with that patient. The patient is placed in a prone or tummy down position. The back is cleaned up well with alcohol and iodine. A lot of local anesthetic is placed in the skin and deeper tissues. The needle then is placed at a 45-degree angle in this direction. And through the needle will be placed this piece of spaghetti, or this lead. And it is electrical lead. It goes underneath the skin, through the needle, and my hand basically is representing your back, the skin of your back. And what essentially is happening here with this lead is sitting on top of the epidural space. It's technically not on the spinal cord. We don't want to be there. We want to be on top of the spinal cord in the epidural space. Again, anesthesiologists do epidurals all the time because we're anesthesiologists, we take care of laboring patients. Again, just because you can do an epidural does not mean you can do pain medicine either. Please note that. So basically, the leads are placed on top in the dura, on top of the dura around the spinal cord. And the leads then give an electrical signal, either in the low back or down the legs to where the patient's having their discomfort. This is your experience, not mine. And this is the reason why you as a patient need to have meaningful verbal contact with your physician. You need to make sure exactly where you feel it. So basically, that's the trial. The needle comes out, it becomes tied to the skin or a dressing is applied, and the patients go home for 7 to 10 days to make sure they have a good, successful trial. I hope this was helpful. Thanks for watching.